Hi everyone, this is Ivan Nagraj, your NORCET mentor and NORCET guide. Okay, I'm back here with a very important series. Okay, Dhamaka series. Okay, very blaster series. That is your ECG. Okay, I think everybody knows it. Okay, ECG is must and should before you go to exam. Okay, before you go to exam. Okay, the most important topic you have to revise is that is ECG. Okay, that is ECG. Okay, your NORCET mains. Okay, prelims. Okay. So NORCET mains and prelims aspect, if you see the ECG part is very important. So I'm requesting you, okay. I'm requesting you, I'm recommending you, okay. I'm recommending you to watch this video, okay, before you appear for the NORCET prelims or mains, okay. My request, okay, it's my humble request. You have to, okay, you must and should watch this video before going to the exam, okay. So it will be very worthy for you, okay. It will be very worthy for you. Trust me, okay, trust me that it's going to be a very important session for the NORCET prelims and mains, okay. So without delay, with a high energy, okay, with a high energy, we'll start the shoe selection series. That is your ECG series, okay, ECG series, okay. In this class, okay, I picked a very important, okay, important MCQs for the NORCET mains and prelims, okay. So that's starting from the basics, okay. So don't be start with some long sum question, okay, lengthy question and interpretation question. So from the basic, okay, included the from easy question also and higher advanced question also. So everything, okay, we'll go with the simple to the complex, okay, we'll go to the simple to the complex now, okay. All of you ready for the class, okay, all of you ready, okay, just join the class, okay, join the class, okay. So I'm waiting for you, everybody. If join means, okay, I'll proceed with the session, okay, right now. So all of you ready, okay. So we'll start with the first question, okay, first question of the session. So I told you, okay, we'll go with the basic, okay, we'll go with the basics to the advanced, okay, we'll go with the basics to the advanced now, right now, okay. So just see first question of the session, okay, here in front of you. First question is, sorry. So like I told you, okay, we'll go with the basics to the complex, okay, we'll go to the basics to the complex now, okay. Here is the first question here right now. So who is the father of the ECG? Okay, first question is who is the father of the ECG? Okay, father of the ECG, as everybody knows that. Okay, father of the ECG is option number A is Aristotle. Option number A is Aristotle. Sorry for the inconvenience. Okay, option B is David Sackett. Option C is William Enthoven. Option number D is Charaka. Okay, options are in front of you. Just to the right answer right here now. So option A is Aristotle. Option B is David Sackett. Option C is the William Enthoven. Option D is the Charaka. We know that, okay, it's a direct question. Okay, it's a direct question. Very easy question. So William Enthoven. Okay, William Enthoven is the right answer. Okay, William Enthoven is considered as the father of ECG because he only invented the ECG. Okay, that's why we are calling William Enthoven as the father of ECG. Okay, David Sackett is father of. We know that, okay, he is the father of evidence-based in medicine. Okay, evidence-based in medicine. Okay, he is the father of. David Sackett is the father of evidence-based medicine. Okay, and Charaka, everybody knows that. Okay, it's a very Indian famous, okay, surgeon. That is he is a father of Indian surgery. Okay, father of surgery. Okay, father of Indian surgery is the Charaka. Okay, Charaka. So all of it clear. Okay, so William Anton is the father of ECG because he invented the machine called as ECG. Okay. So second question will be here. Just see. I told, okay, we'll go with the basics to the ECG. Okay, basic to the advanced question. Okay. So second question is, okay. Some basic question I told you, it's very basic question. The basic principle, okay, the basic principle used in the ECG machine, okay. What is the basic principle used in the ECG machine? Okay, options are here. Okay, option number E is voltage principle. Option number B is galvanometer. Option C is tungsten. Okay, tungsten principle. Okay, option D is none. Okay, just consider option D is none. Okay, so which one is the right answer? Okay, which one is the right answer? So everybody knows that. Okay, very easy. Okay, direct question. Okay, we'll use the principle called as galvanometer. Okay, galvanometer is in beta. It's a machine. Okay, it is a machine that will that will detect, okay, that will detect the current, okay, that will detect the electrical current, okay, current. That's what we call as galvanometer. Okay, galvanometer principle is used in the basic ECG machine. Okay, we know that, okay, electrical activity will be going on from the in the heart. Okay, we know that, okay, SA node, AV node, okay, bundle of phase, package fiber, this all, okay, through that all this conductor system, the electrical current, okay, the electrical current is moving on. So we want to pick that electrical current, okay, conductive activity of the heart, okay. So we'll use a machine called as galvanometer, okay. That is a basic principle used in the ECG machine. Okay, all of it clear? So we'll go with the third question. Okay, I told you. Okay, we'll go with the basics to the advanced question. Okay, basics to the advanced question. Okay, here is a some different. Okay, some difficult. We can say some little bit uplifted question here. So we are here. We are having a 45-year-old male admitted in a surgery ward with a high stoma output. Okay, with a high stoma output means he undergone for the ileostomy or colostomy procedure. Okay, now he is having the high output of the stoma. Okay, and having a low potassium values. Okay, we know that okay, your GI content, okay, your GI content is rich in potassium. Okay, rich in potassium. If the patient is having high stoma output, okay, maybe a diarrhea also if you're having the stoma output more than 100 ml per 2 hours, okay, so so all GI content will be lost. So there will be a low potassium level. Okay. So an ECG taken, okay, to rule out the electrolyte, okay, this electrolyte imbalance, okay, to rule out that one only, they taken ECG, okay. So to rule out the arrhythmias, okay, and given ECG shows okay prominent E waves, okay, prominent U waves. So what is the U wave indicates here, okay, what is the U wave indicates in the ECG, okay, you can see here this one is a P wave, okay, P Q R S T and U, okay, and U, okay. One more wave is added here, okay. Normally U wave, okay. Normally U wave is not seen in the normal ECG, but here due to the electrolyte imbalance, okay, there is a prominent view, okay. Prominent U wave means there is a visible of another wave that is a U wave, okay. So what does it indicate, okay? What does it indicate, okay? Just see here, okay. So we will see, okay, what are the like all waves in a ECG will indicate, okay. What the all waves in a ECG will indicate, okay. Just see here. So, okay, starting from the P wave, okay, starting from the P wave, okay, starting from the P wave, okay, we'll see. Starting from the P wave, QRS, okay, P will go with the QRS complex, then T wave, then U wave, okay, last U wave, okay. So we know that, okay, we know that, okay, so options, okay, P wave indicate, okay, P wave indicate atrial contraction, okay, both your atrium, okay, right atrium and left atrium, okay, both are getting contracted, okay, atrial contraction, okay, we can say it is a atrial contraction, okay, P wave indicate atrial contraction or the atrial depolarization, okay, or the atrial depolarization, okay. What do you mean by depolarization? Means influx of the cation, okay, that's what we call as depolarization, okay, or else you can say atrial contraction, we can say it is a atrial contraction, okay. PU indicate atrial contraction and QRS complex indicate ventricular contraction, okay, both, okay, left ventricle and the right ventricle, okay. It shows ventricular contraction, okay, it indicate ventricular contraction, okay, or else we can say a ventricular depolarization, okay. It denote, okay, ventricular depolarization, okay, or else it shows ventricular contraction, okay, ventricular contraction or ventricular systole, okay, systole. So T wave, okay, if you talk about the T wave, it indicates the ventricular relaxation, okay, ventricular relaxation, or else we can say ventricular repolarization, okay, repolarization, okay, it is the ventricular repolarization, okay. So normally in a ECG, we will not see any because we know that okay, after ventricular contraction, there should be a ventricular relaxation, okay. After the ventricular depolarization, after there will be a ventricular repolarization should happen, okay. But if you can see here, okay, there is a atrial contraction is happening, okay, but there is no reaction, okay, but there is no relaxation, but there is no repolarization, okay, will be seen in the ECG because we know that okay, QRS complex is a very big complex, okay. If we see this one is a P wave, QRS complex is a very bigger wave, okay. Due to the bigger QRS complex, okay, the U wave will not be seen in a normal ECG. But if there is an electrolyte imbalance, you can see a U wave, okay. It did not, okay, atrial repolarization, okay. Denote atrial repolarization, okay. Atrial repolarization or the diastole, okay. Atrial diastole, okay. It shows, okay, atrial diastole, okay, diastolic. It shows atrial diastole. Okay. So that's what your U wave indicate in a ECG. Okay. All of it clear? So now, okay, here is the options in front of you. Okay, choose the right answer. Okay, so U wave indicate option number A is atrial depolarization. Option B is ventricular repolarization. Option C is atrial repolarization. Option D is ventricular repolarization. Okay, just because of like I already explained to you. Okay, what do you mean by P wave, Q wave, and QRS wave and the T wave? Okay, so option number C is the right answer right now here. So in U wave indicate, okay, U wave indicate atrial repolarization. Okay, U wave indicate atrial repolarization means atrium is getting relaxed. Okay, atrium is getting relaxed. Okay, diastole of the atrium. Okay. So what is the relationship between the U wave and the potassium? Okay, relationship between the potassium and the U wave. Okay, if you ask me, sir, what is the relation between the U wave and the potassium? Okay, I will say they are okay both. Okay, your potassium and U wave are the inversely related. Okay, if you see potassium, it is inversely related. Okay, it is directly related to the T wave. It is inversely related to the U wave. Okay, if there is any hypokalemia, okay, if there is any potassium low in the body, okay, so there will be an increase. Okay, there will be a prominent U wave. Okay, there will be a prominent U wave seen on the ECG. Okay, all of you clear? So that is a main relationship between the potassium and the E wave. Okay, if there is a hypokalemia, there will be always there will be a low, okay, low amplitude T wave will be there. Okay, so T wave and the potassium is directly related, and U wave and the potassium is inversely proportional. Okay, they are inversely proportional. Okay, so all of you clear regarding the U wave and the potassium? Okay, all of you clear? All of you okay? All of you okay? If you okay means okay, just put a just raise your thumbs up in a comment section. Okay, I'll be okay with that one. So I'll move towards the again further question. Okay, if there is any doubt, okay, we'll settle it here only. Okay, we'll settle it here only as soon as possible because doubts arise. Okay, how to sort out here only. Okay. So if after session also you can put a comment in the comment section. Okay, I'll be there or I'll be there to solve the questions right now. Okay. Okay, clear? Just okay. I want your okay. I want everybody's to be concentrated here. Okay, I want everyone's focus here. I want everybody's attention here. Okay, don't watch here and there. Just sit in an okay. Just sit in a study table or else anywhere. Okay, just sit in a calm pace. Okay, so that it can focus. You can concentrate on the class. Okay. So this one is third question. Okay, now we'll go with the fourth question. Okay, fourth question. So what are the components? Okay, here is a say like a simple question. Okay, simple question. What are the components of William Antoine triangle? Okay, so here the examiner is asking you what is a triangle? Okay, what is the component of the Williams Antoine triangle? Okay, I told you. Okay, Williams Antoine is a scientist. Okay, who invented ECG. So we are calling him as the father of Antoine. So he made a triangle. Okay, so what are the components of the triangle? Okay, you can see options are augmented vector, right? Okay, AVR, that this one is AVL. Okay, actually it's a mistake. Okay, AVL. Okay, it is a AVL. Okay, AVL V2, and option number B is AVL, AVF, and V6. Okay, option number C is AVF, AVR, and V3. Option number D is AVR, AVL, and AVF. Okay, if you see all options are here in front of you, just try to put the right answer in the comment section. I'm waiting for your answer right now. Okay, just because I want everybody to be focused here. Okay, I want everybody concentrated. If you participate, okay, if you actively try to put the comments in a comment box, so it denotes you are actively listening. Okay, you are actively listening, you are actively focusing, and you are actively participating in the session. Okay, then only it will be a worthy give and take. Okay, it should be a two-way. Okay, I likes the two-way communication always. Okay, here you can see. So normally, okay, here is your heart. Okay, here is your heart at the circle. Okay, at the center, heart is there. Okay, and if you see, okay, from the here, okay, from the here, one way will be one vector. Okay, one current vector will be going on. Okay, all the direction. Okay, the heart will be depolarizing. Okay, it will discharging the electrical current. Okay, from the SA node to the AV node and all. Okay, so this one. Okay, at the right side. Okay, we having the right. Okay, right side. This one is the right side. This one is the left side of the body. This one is the foot part. Okay, foot part. Okay, if we say so, order the all okay, all augmented vectors. Okay, all augmented vectors. Okay, from the coming from the right hand side. Okay, will be taken by the lids. Okay, by the limb lids called as AVR. Okay, AVR nothing but the augmented. Okay, AVR nothing but the augmented vector. Okay, augmented vector nothing but it's a collection of electrical waves. Okay, it's a collection of electrical wave. Okay, R nothing but a right. Okay, R nothing but a right. Okay, this one is a AVR. This one is the left side. Okay, augmented vector left. Okay, and this one is F for foot. Okay, F for foot. Okay, AVF. Okay, AVF nothing but a augmented vector foot. Okay, so this will all make a triangle here. Okay, this will all make a triangle. If you club the all vector, okay, it will make as a triangle. Okay, so this all three are the triangle. Okay, this all three are the component of William Einthoven triangle. Okay, so AVR, AVL, and AVF. Okay, these three are the component of the vector. Okay, so just come for the options right now. Okay, you can see the option number D. Option number D is the right answer because it includes the AVR, AVL, and AVF. Okay, these all three are considered to be a William Einthoven triangle. Okay, all of you clear? All of you getting my points? Okay, whether it is fast or slow, okay, you can modify the class. Okay, after recording, you can modify the class. Okay, you can watch in a 2x, you can watch in a 1x. Okay, as much as you are like convenience, you can change the speed of the video also. Okay, all of you getting clear? So okay, we'll move for the fifth question right now. Okay, fifth question right now. So here is your fifth question. Okay, we are having the like this one is from the physical examination part of you. Okay, physical examination part of you. Here we are having the patient admitted in a coronary care unit. Okay, coronary care unit after the mitral wall replacement surgery. Okay, after mitral wall replacement surgery. Okay, during the physical examination, the resident keeps the diaphragm of the stethoscope over the Erb's area. Okay, over the Erb's area. Okay, so what is the exact location of the Erb's area? Okay, here they're asking you regarding the physical examination part. So where is the Erb's area exactly located in the on the chest? Okay, so option A is the second intercostal space, a right sternal border. Option number B is second intercostal space, left sternal border. Option number 3 is third intercostal space, left sternal border. And option number D is fifth intercostal space, left sternal border. Okay, options are here right now. Choose your right answer. Okay, and answer in a comment box. Okay, a comment box. So I'm waiting for your answer right now. Okay, just try to put the right answer right now here. So you can see, okay, if this one is considered as okay, if this one is considered as your like sternum, sorry. So like just I'll locate all your like auscultation point. Okay, all your auscultation point here, all auscultation point. Auscultation, okay, auscultation of heart sound, okay, auscultation of heart, okay, auscultation of heart, okay. What are the locations here? Okay, first one to say aortic area, okay, first one to say aortic area, okay, aortic area. So 6 points are there, okay, aortic area will comes in the okay, right sternal border, okay, in the right sternal border, okay, in the right hand, okay, right hand sternal border, okay, we can say right hand sternal border, okay, at the second intercostal space, okay, at the second intercostal space, okay, and second to say pulmonic area, okay, aortic area, you can see the all your aortic wall, okay, aortic wall defect, okay, aortic stenosis, aortic regurgitation, okay, you can able to feel in the aortic area, okay, that is your right hand, okay, right sternal border, okay, right sternal border at the first knee, okay, second intercostal space, okay, at the second intercostal space, okay. So then, okay, coming for the pulmonic area, okay, it's coming for the pulmonic area, okay, pulmonic area, same only. But this one is the left sternal border, okay, left sternal border, that is your second intercostal space, okay, second intercostal space, okay, pulmonic area is left sternal border, pulmonic, okay, left sternal border, that is your second intercostal space, okay, and then coming for the middle one, that is your Erb's area. Coming for the herbs area, that is like asked in your exam. Okay, herbs area is okay. It comes in the third intercostal space. Okay, comes in the third intercostal space. That is your okay left sternal border. Okay, left sternal border. Okay, third intercostal space. That is your third. And like we just see. Okay, just below to the pulmonary area. Okay, left sternal border. Just exactly below the second intercostal space. That is your third intercostal space. Is the exact location of the Erbs area. Okay, then coming for the tricuspid area. Okay, tricuspid area. Okay, tricuspid area. Okay, tricuspid area. So this one is exactly at the fifth ICC, fifth intercostal space at the left sternal border. Okay, at the left sternal border. Okay, the left sternal border is the exact location of the tricuspid area. Okay, and able to listen the tricuspid regurgitation or tricuspid wall prolapse. You can see the all murmurs can be seen in the fifth intercostal space. That is your third intercostal fifth intercostal space at the left sternal border. Okay, then coming for the mitral wall. Okay, mitral wall. Okay, in the mitral wall. Okay, mitral wall area. That is same exactly as the fifth intercostal space. Okay, here also fifth intercostal space, but here at the mid clavicular line. Okay, it's a imaginary. Okay, here if this one is a clavicle. Okay, just divide the clavicle in a half. So exactly at the mid clavicular line. Okay, how to draw imaginary line. Okay, imaginary line. Exactly over the fifth intercostal space. You have to keep the diaphragm of the bell. Okay, so here the examiner asked the location of the herbs area. Okay, so herbs area is the third intercostal space. Left sternal border is the right answer right now. Okay, this okay. We'll see for the answer right now. Okay, third intercostal space. Left sternal border is the right answer. Okay, for auscultation. Okay, for auscultation, you can choose the for herbs area. Third intercostal space. That is your left sternal border. Okay, all of it clear. So what are the different kind of okay all your hard auscultation points. Okay. Then going for the next question. Okay, sixth question. Here we're having the like ECG based question. Okay, here we're having a patient. Okay, came for the OPD for routine checkup. Okay, and the ECG was taken for the cardiac evaluation. Okay, and calculate the ECG. Calculate the given below ECG heart rate. Okay, normal. Okay, basic question. Okay, how to calculate the heart rate. Okay, based on the ECG, you can see the ECG. Okay, you can see the ECG, and then you can able to choose the right answer. Okay, how to calculate the heart rate. Okay. So I'm telling you continuously, okay, if anybody tells to you, okay, read the ECG, first you have to calculate whenever the ECG comes in your hand, first you have to go for the heart rate calculation. Okay, if the heart rate is okay, then you can go for the rhythms. Okay, first you have to check the rate, then you have to go for the rhythm. Okay, first always your priority should be the rate. Okay, should be the rate. Okay, then you go for the rhythm check. Okay, rhythm, how is the rhythm? Okay, then you go for the rhythm. Okay, first always and always have to check the heart rate. Okay, so options are right now here. Okay, based on ECG, you can calculate the rate. Okay, 82 beats per minute, 75 beats per minute. Okay, 85 beats per minute, and option number D is 80 beats per minute. Okay, these are the answers options right now. Just choose the right answer. Okay, I'm waiting for your answers. So just see. Okay, I told you. Okay, first we have to check the rate. Okay, rate. How we can check the rate? By we are having the two rate. Okay, ventricular rate. We are having the all our like atrium and ventricular rate will be normal only. So both your atrium, if having the normal cardiac rhythm, your arterial rate and ventricular rate both will be same. Okay, both will be same. Okay. So if you see about the ventricular rate and the atrial rate, okay, both are same. So same formula is used for the both. Okay, atrial rate and the ventricular rate. Okay, atrial rate and the ventricular rate. Okay, 300 divided by the RR interval. Okay, RR interval. Okay, RR interval you have to see. Okay, RR interval we have to see for the ventricular rate. Okay, and if you see talk about the atrial rate. Okay, 300 divided by the PP interval. Okay, P interval. Okay, PP interval we have to see. Okay, PP interval you have to see. So just calculate here. Okay, given ECG, based on given ECG, you can see. So you can see the okay, you can take any leads. Okay, any leads. Okay, from the we can take okay because we consider the lead number two as a significant lead. Okay, this one is the last one is always it is a lead number two. Okay, lead number two. Okay, second lead. Okay, so you can see this one is the R wave and here is a one R wave. Okay, so calculate the R wave. R wave. Okay, small box. Okay, the RR interval we have to calculate the small box here. Okay, so large box here. Okay, so that is your calculate. Okay, one large box. Okay, two, three, and four. Okay, four small box are there. So you calculate. Okay, 300 divided by both four. If you calculate, okay, you'll get the 75 beats per minute. Okay, you'll get the rate of 75 beats per minute. Okay, option number B is the right answer. Okay, option number B is the right answer. Okay, all of you clear? So how to calculate the rate? Okay, atrial rate, nothing but we have to calculate the RR interval. Okay, RR interval. So how many boxes are there? Okay, how many boxes are there? You have to calculate and you have to divide it with the 300. Okay, and if you want the atrial rate, okay, if you want the atrial rate, you have to calculate with the PP interval. Okay, you can see here P wave here and P wave here. Okay, so calculate the rate. Okay, how much is the rate? 1, 2, 3, 4. So same only. Okay, so we are having the four small box. Okay, if you calculate 300 divided by 4, you'll get the 75 rate. So in normal ECG, okay, normal healthy individual, for atrial rate and the ventricular rate, both will be same. Okay, if there is any arrhythmias are there, okay, if any arrhythmias are there, you have to multiply with the 4. Okay, in case of any arrhythmias, you have to multiply with the 10, then you will get the exact rate of the atrium. Okay. All of you clear regarding the sixth question. So if you clear means we'll go with the seventh question right now here. Okay, here we're having the 45-year-old male admitted in a medicine ward with the with the diagnosis of a rheumatic heart disease on a continuous cardiac monitor, okay, shows abnormal ECG pattern, okay, abnormal ECG pattern, okay. By observing the given below ECG, identify the primary diagnosis, okay, primary diagnosis, okay, the primary diagnosis, nothing but here they are asking you regarding the which kind of cardiac arrhythmia it is, okay, which kind of cardiac arrhythmia, okay, cardiac arrhythmia given in the ECG, okay, given in the ECG, okay, which one is the cardiac arrhythmia given in the ECG? Here you can see here, okay, already given the hint, okay, sawtooth appearance on the ECG, okay, if the ECG is normally our ECG will be P wave followed by QRS, okay, followed by QRS wave, then the T wave, okay, will be there. Then again, okay, there will be a P wave, again QRS complex, okay, again there will be a T wave, okay, like that will be there. But here you can see you can see that okay ECG okay here okay there is no P wave okay P wave is like this and again QRS complex okay again there is a PQRS okay T wave like this okay so here there is a sawtooth okay here you can see that that appearance of sawtooth okay sawtooth is there so here on the ECG okay sawtooth is there okay so sawtooth appearance on ECG seen in case of so options are here. Okay, options are here below. Just see the options. Okay, atrial flutter. Option number A is atrial flutter. Option number B is atrial fibrillation. Option number C is cor pulmonale. Option number D is left atrial enlargement. Okay, so options are here. Okay, just choose the right answer right now here. You can say, okay, this one is the actually okay, very easy. I made it very easy because so much of clue. Okay, already if any word, okay, if the ECG, and okay, if there is a word coming as the sawtooth, okay, you have to go for the atrial flutter only. Okay, in atrial flutter, okay, the rate will be more than 200 beats per minute. Okay, the heart rate will be more than 200 beats per minute, and you can see the P wave. Okay, P wave replaced by the P wave is replaced by the sawtooth. Okay, it will be replaced as the it will be seen normally it will be seen as the hollow okay this the hollow like structure but here you can see the PO as the sawtooth appearance okay sawtooth appearance okay that's what you can see in the atrial flutter okay if you see the fibrillation okay in fibrillation okay you can see the P wave as a fibrillating wave okay P wave this one is again QRS complex again T wave okay again there is a P wave is as a fibrillating wave okay P wave you can see as the fibrillating wave only okay in the fibrillation or else there'll be absent okay if you consider about the fibrillation there'll be absent okay there'll be absent P wave okay absent P wave will be there in a atrial fibrillation or there will be a shivering okay or there will be a shivering of the or there will be shivering of the P wave will be there okay if you talk about the cor pulmonale you can see a P wave as the P pulmonale wave okay you can see P wave as the P pulmonale wave okay cor pulmonale there will be a atrial enlargement will be there in a cor pulmonale okay. Yes, you see, okay. Normally, if we talk about the P wave, okay, it is made up of two waves, okay, right now. Okay, first is half is made up of right atrium and left next half is made up of this one is made up of right atrium, okay. This one is made up of half is made up of left atrium, okay. If there is any problem with the right atrium, okay, if there is any problem with the right atrium, like if you talk about the corpus Malay, you can have the ECG like a P wave, okay. ECG you can have like a P wave, okay. We call this one as P pulmonale wave, okay. P pulmonale wave because if there is any COPD, okay. If there is any COPD, in case of COPD, there will be a right atrium enlargement will be there, okay. That's why you will have the P pulmonale wave, okay. You can have the P pulmonale wave, okay. And if you see, okay, if there is any left atrium enlargement, okay, if there is any left atrium enlargement, okay, you will have the PM wave, okay. If the P wave will be like M wave. Okay, P wave will be like a M wave. Okay, we call this one as the mitral wave. Okay, mitral wave. Okay, we call this one as mitral wave. Okay, seen in case of mitral stenosis and mitral wall prolapse. Okay, you can see the M mitral wall. Okay, all of it clear. Okay, this P wave is both P wave. Okay, is made up of by the half is made up of by the right atrium and half is made up of by the left atrium. Okay, all of it clear regarding this one. Okay, we'll see next question. We'll go with the next question. Question number 8 is right in front of you. Here we're having the which of the following is the here we're having the following is regarding which of the following is the true regarding sick sinus syndrome. Okay, sick sinus syndrome. Okay, triple S. Okay, that is your sick sinus syndrome. Okay, there is a syndrome called as a sick sinus syndrome. Okay, sick sinus syndrome. Okay, triple S syndrome. We can say that one as the a sick sinus syndrome. Okay, options are here, right? Okay, see, option A is treated using beta blocker. Option B is frequently seen in the patient with the atrial fibrillation. Option number C is the most of the patient are asymptomatic in earlier stage. Option number D is most commonly seen in the young patient. Okay, most commonly seen in the young patient. Okay, so if we see, if I think nobody like knows regarding the sick sinus syndrome. Okay, here there is a syndrome called as a triple S syndrome. Okay, we call that one as the triple S syndrome. Okay, sick sinus syndrome. Okay, normally what will happen? Your SA node. Okay, if we can call this one as sick SA node. Okay, sick SA node syndrome. Okay, we can call this one as the sick SA node syndrome. Normally it will happen. What happen? The SA node will produce the all. Okay, pacemaker. Okay, all electrical rhythm will start from the SA node and it will go to the AV node and it will go to the bundle of phase. Okay, then it will go to the Purkinje's fiber. Okay, but here what will happen in a sick sinus syndrome? The SA node is exactly not firing properly. Okay, some ectopics will be there. So all ectopics, okay, ectopics bundle of cans, okay, there will be a electrical discharge will be there. Okay, that's why there will be a sudden bradycardia, sudden tachycardia. Okay, there will be a sudden tachycardia, sudden bradycardia. Okay, sudden tachycardia and sudden bradycardia will be there. Okay, both will be there. Okay, we can call this one as the tachybrady syndrome. Okay, another name for the triple S syndrome is Brady syndrome. Okay, Brady syndrome. Okay, we can call this one as the Brady syndrome. Okay, all of it clear? Tachy and Brady syndrome. Okay. So normally this will be there. Okay, so main choice of treatment for this patient is pacemaker if they are symptomatic. Okay, normally at the initial phase, they'll not be having any symptoms until they'll do any vigorous activities like exercises, okay, playing and any other like exertional works means that time only they'll be having the dizziness, okay, and there'll be loss of consciousness will be there. So that all will be there when they'll do a physical exertion. If they're resting, normally is there means there is no symptom. Okay, initially there will not be any symptoms. Okay, there will be a asymptomatic. Okay, and only treatment of choice for this case is if there is any symptoms occurs. Okay, we have to go with the pacemaker. Okay, pacemaker is a treatment of choice. Okay, pacemaker is the treatment of choice for the case of sick sinus syndrome. Okay, all of you clear? So we'll not use any beta blocker. I told you we can use the only treatment of choice as a pacemaker. Okay, we'll not use the beta blocker because if you know here, okay, if there is any bradycardia, if you give the beta blocker, again there will be a worsening of the symptoms will be there. Okay, so that's why if there is any tachycardia, then we will go. But here there is a simultaneously occurring of tachycardia and bradycardia. If you see the patient, okay, half an hour before they will be having the heart rate of 140. And if you see after half an hour, if the heart rate will be coming up to the 40, 30 and all, okay, that's why beta blocker is not used as the treatment of choice in the sick sinus syndrome, okay. So here I told you, okay, it's not frequently seen in the atrial fibrillation, okay. So option number C is the right answer, okay. Most of the patients are asymptomatic, sorry, it is asymptomatic, okay. It is most of the patients are asymptomatic in earlier stage, okay. And it is not like its age variation is not at all defined, okay. It's seen in a young patient also, can be seen in a older age patient also. Okay, so option number C is the right answer. Okay, most of the patients are asymptomatic in a earlier stage. Okay, whenever they until they'll do any physical exertion, you'll not see the any of the symptoms cannot be seen in the patient. Okay, all of it clear regarding this one, regarding the eighth question. Okay, now we'll move towards the ninth question. Okay, now we'll go for the ninth question. So here, okay, it's a right question. Okay, you can see here right now. Here, which one of the ninth question? Which among the given is ECG is not a narrow complex? Okay, non-narrow Kivores complex tachycardia. Okay, so we have to choose the pick ECG which one is not having a narrow Kivores complex. Okay, so options are here right now. Okay, SVT. Option number B is PSVT. Option number C is MAT. Option number D is ventricular tachycardia. Okay, options are right now here. Okay, choose the right answer. Okay, just think, analyze the question. Okay, then read out then try to put the answer in the comment section. Okay. So before narrow and before like broader, you should know the difference between like which one is considered to be a narrow, which one is considered to be a broader. Okay, we'll see now. Okay, which one is broader and which one is narrower. Okay. So Kivores complex, okay, what is a normal? I'm asking you, okay, which one is a normal? What is a normal Kivores complex duration? Okay, before knowing which one is a narrow, which one is broader, you should know. Okay, you should know which one is a broader and which one is a narrow. Okay, what is a normal Kivores complex duration? Or normal QRS duration. Okay, normal QRS duration will be around 0.08 to the 0.10. Okay, 0.10 second is the normal QRS duration. Okay, if it is more than 0. 0.12 second. Okay, 12 second we call that one as broader QRS complex. Okay, we call that one as broader QRS complex. Okay, broader QRS complex. Okay, if it is less than 0.06 second. Okay, we call that one as narrow QRS complex. Okay, we call that one as narrow QRS complex. Okay, narrow QRS complex arrhythmias. Okay, so here you can see for saying this one. Okay, like we know that okay, one small square. Okay, one small box is equal to 0.04 second. Okay, 0.04 second. Okay, normally it will be all your QRS complex should be a two small box. Okay, two small boxes. Okay, two small boxes, nothing but a 0.08. Okay, so one large box is equal to 0.20 second. Okay, 0.20 second means five small box is equal to one large box. Okay, that's your 0.20 seconds. Okay, that is your normal QRS complex duration. Okay, that if it is more than a 0.1012, we call that one as broader QRS. Okay, if there is less than 0.06, we call that one as narrow QRS complex. Okay, all of you clear regarding the broader complex and the narrow QRS complex? So now we'll see. Okay, now we'll go for the like here you can see SVT. Okay, in SVT, what will happen? Okay, SVT is also considered to be a SVT, PSVT, and multifocal atrial tachycardia. All three are considered to be a narrow complex. Okay, all three are considered to be a narrow complex. Okay, if we see VT is the right answer because VT is having VT QRS duration having more than 0.12 second. Okay, it is 0.12 second. That's why it comes as under the broader QRS complex. Okay, it comes into the category of broader QRS complex arrhythmias. Okay, broader QRS complex arrhythmias. Okay, if it see about the supraventricular tachycardia, you can see a narrow QRS complex. Okay, the P will not be there. So the QRS complex is very narrowed here. Okay, the QRS complex is very narrowed here. Okay, very narrow QRS complex will be there. Okay, if you talk about the QRS complex, okay, it is very narrowed QRS complex. Okay, so it will be less than a 0.06 second. Okay, less than 0.06 second will be there. Okay, and if you see what is the difference between the normal VT and SVTs, that is a basic difference. Okay, if you see in the VT, okay, if you see in the VT, there will be a broader QRS complex. Okay, you can see the broader QRS complex. Okay, you can see the broader QRS complex right now. Okay, you can see more than a three box. Okay, more than three boxes. You can see the more than a three small box. Okay, more than a three small box. You can see the all QRS complex. Okay, that will be more than 0.10 second. Okay, that's so basic difference between the SVT and PSVT. Okay, if we see about the paroxysmal like we can say on and off. Okay, the term paroxysmal nothing but a on and off. If there is any SVT, okay, if there is any SVT occurring, okay, SVT on and off. Okay, on and off is called as paroxysmal. Okay, suddenly occurrence of SVT and suddenly disappearing of the SVT is called as paroxysmal ventricular tachycardia. And if you see about the MAT, okay, in a MAT nothing but a multifocal. Okay, MAT nothing but a multifocal atrial tachycardia. Okay, atrial tachycardia. Okay, it is a mainly like basically it is a atrial arrhythmias. Okay, it's a atrial arrhythmias. Okay, here you can see the three different P wave. Okay, one P wave is normal. Okay, one P wave is like this. This in a mat. Okay, I'm drawing the mat. Okay, see mat la. So there will be P wave will be different. Okay, three different P wave will be there. Okay, one P wave is like this. Okay, one P wave is like this and one POA is taller. Okay, so all three different POAs will be there. That's why we are calling this one as multifocal atrial tachycardia. We can calling this one as multifocal atrial tachycardia, also called as okay. MAT is also called as wandering of pacemaker. Okay, is also called as wandering of pacemaker syndrome. Okay, wandering of pacemaker. Okay, pacemaker syndrome means the SA node is not properly working here. Okay, there will be a ectopic current will be produced from the other bundles. Okay, that's what we call as wandering of pacemaker syndrome. Okay, MAT is also called as wandering of pacemaker syndrome. Okay, all of you clear regarding the ninth question. Okay, now we'll go with the 10th question. Okay, 10th question from the ECG. Okay, and here we are having the antenatal mother came to the clinic for the routine checkup. Okay, for the routine checkup, and given below ECG was taken as a routine checkup. Okay, and identify the abnormal finding in the given ECG. Okay, identify the abnormal finding in the given ECG. Okay, you can see this one is a P wave. Okay, this one is a P wave. This one is Q, R, S and T. Okay, S and T will be there. Okay, three. Okay, four waves are there. So options are here right now. Option number A is P pulmonary wave. Option number B is a biphasic P wave. Option number C is mitral P wave. Option number D is P wave with the amplitude of more than 2.5 millivolt. Okay, 2.5 millivolt. Okay, we see it, normally ECG speed. Okay, normally ECG paper speed will be of 25 25 mm per second. Okay, 25 mm per millimeter of second. Okay, and if you see normal amplitude, okay, normal amplitude of electrical current, okay, normal amplitude of current will be of 0.1 millivolt. Okay, millivolt per second is the normal amplitude of ECG wave. Okay, ECG wave will be there. Okay, so here if you see the PU normally it should be amplitude will be less than, okay, it should be less than 2 millivolt. Okay, normal P wave. Okay, normal P wave amplitude should be less than 2 millivolts. Okay, here it should be normally it should be P wave should be round and hollow. Okay, so then QRS complex will be coming out. But here you can see there is a tall P wave. Okay, there is a tall P wave is there. Okay, if you see the almost okay, it is equal to the R wave. Okay, here the P wave is equal to the PU is equal to the R wave. Okay, PU is equal to almost its height will be it is normal. So here it is the option number D is the right one. Okay, here the amplitude of P wave is taller. We can say the ECG is given. ECG is a tall P wave. Okay, here they are having a tall P wave. Okay, tall P wave is there. Here you can see that there is a tall P wave is present. Okay, so that's what we see in case of the rheumatic heart disease. You can see the tall P waves. Okay, tall P wave can be seen. Okay, that will be having the amplitude of more than 2.5 millivolts per second. Okay, that's one is the main thing. Okay, P pulmonary wave, I told you it's in case of core pulmonary. You can see the right atrial involvements. You can see the P pulmonary waves. Okay, it will be around like this. Okay, that will be look like a P wave. Okay, that's a P wave look like a P wave. Okay, and if you see biphasic P wave, okay, but P wave will be like this. Okay, the P wave will be a biphasic. Okay, then it will turns into the biphasic P will be half will be positive reflection, half will be negative reflection. Then QRS complex. Okay, this one is the biphasic P wave. Okay, this will be seen in case of V1 lead. Okay, and I told you P mitral wave. Okay, P mitral wave nothing but a P wave looks like a EM. Okay, P wave will look like a EM. Can be seen in case of left atrium enlargement. Okay, that is a mitral stenosis and all. You can see the P mitral wave. Okay, that is your P mitral level. Also, option number D is the right answer. Okay, you can see the tall P wave. Okay, tall P wave with the amplitude of more than 2 millivolts per minute. Okay, per second. Okay, sorry. So coming for the 11th question of the session. Okay, coming for the 11th question. Here is a 11th question. Sorry. Here is the 11th question. Okay, here we're having the 32-year-old male present to the emergency department and is having a sudden onset of chest pain and sweating, and an ECG was taken immediately. Okay, to interpret the ECG given below. Okay, here we're having the patient. Okay, now the patient came to the hospital with a sweating and a chest pain. Okay, so that of course, okay, if there is a chest pain, okay, they will take a ECG immediately. Okay, so ECG was already taken, and we have to interpret the ECG. Okay, what is the abnormal finding should be sorted out from the ECG. Okay, you can see here. So 12 lead ECG is there. Okay, now we are having the 12 lead ECG is there. Okay, 12 lead ECG is there. Okay, you can read out the ECG and you try to give a right answer. Okay, which one is ECG is exactly this one is. Okay, options are here right now. Option A is a left bundle branch block. Option number B is a right bundle branch block. Option number C is a normal sinus rhythm. Option number D is the MAT. Okay, multifocal atrial tachycardia. Nothing but a wandering of a pacemaker syndrome. Okay, options are right now. Just to the right answer right here. So I can see the ECG here now. Okay. So what is the basic problem you can see here? Okay, I'll zoom out the ECG. You can see. So see the ECG, okay, and try to put the right answer here. Okay, you can see the ECG. I'm zooming out. Okay, zooming out. So here is the ECG. Okay, you can see ECG here. Okay, you can see from the lead one. Okay, from the lead one. Okay, you can see there is a M pattern. Okay, there is a M pattern. Okay, here you can see there is a M pattern. Okay, there is a in lead number one. Okay, in lead number one there is a M pattern. Okay, and you can see in lead number three there is a slow obstruct. Okay, there is a W pattern. Okay, there is a W pattern. Okay, you can see again. See, you can see in a V6. Okay, V6 there is a M pattern. Again, there is a M pattern. Okay, you can see here. Okay, there is a M pattern QRS complex. Okay, N pattern R wave. Okay, M pattern R wave, and you can see V1 there is a deep. Okay, V1 there is a deep R wave. Okay, deep R wave is there. Okay, this all are the findings. Okay, showing that there is the left bundle branch block. Okay, there is a left bundle branch block. Okay, so in left bundle branch, okay, block, there will be a, in V1 there will be a W wave. Okay, in V1 there is a R wave will be a W pattern. Okay, and V6, okay, and V6 you can see the, and V6 you can see the M pattern. Okay, M pattern R wave. Okay, M pattern R wave can be seen in case of left bundle branch block. Okay, this all are the cardinal features of the left bundle branch block. Okay, left bundle branch block. Okay, all of you clear regarding the bundle branch block? So which one is the right answer? Okay, so right answer will be a left bundle branch block. Okay, it is a left bundle branch block. Okay, all of you clear? What is the left bundle branch and what is the right bundle branch? Sorry. So I'm telling you, okay. So here I'm writing down, okay, with maybe some visual part defect. Okay, so see in V1, okay, you can see in left bundle branch, okay, you can see the in V1 lead, you can see a W wave, okay, W R wave, okay, you can see the W R wave, okay, you can see the W R wave. Normally R wave will be like this, okay. So there will be a the R wave will be will be having a deep R wave will be there. Along with that one, there will be a W R wave will be there, okay. W R wave will be there, and we can see the in V6, okay, in V6 you can see the M wave, okay, M R wave, okay, M R wave pattern will be there, okay, M R wave pattern will be there, okay. So that is mainly seen in case of left bundle branch block, okay, left bundle branch block, okay. All of it clear? In a right bundle branch, opposite to that one, okay, opposite to that one, okay. In V1 you can see the M wave, in V6 you can see the W wave, okay. That is the main basic difference between the right bundle branch block and a left bundle branch block. Okay, normal sinus rhythm will be having a same normal P wave, QRS wave, and T wave. Okay, that is a normal sinus rhythm. Okay, and see, I told you multifocal atrial tachycardia. There will be a three different. Okay, there will be a three different P wave will be there. Okay, now multifocal atrial tachycardia. Okay, all of you clear regarding the left bundle branch block? So normally what will happen? Okay, so if you see this one is your heart. Okay, this one is your SA node and this one is your AV node and this one is your bundle of fish. Okay, Purkinje fiber and the bundles. Okay, if this one is your heart. Okay, this one is your heart. So normally, okay, this SA node will produce the current, then it will go to the AV node, then it will go to the right bundle. This one is a left bundle. This one is a right bundle. So electrical current will be gone to the equally to the right and left part. Okay, if there is any problem with the block here in the left hand, so there will be a, so we know that, okay, your QRS complex is made up of this is made up of ventricular depolarization, okay, QRS complex. So if there is any block, so there will be a R wave abnormality, okay. So R wave will not be made properly, so there will be a M or W pattern of R wave will be there in a bundle branch block, okay. Also clear regarding the bundle branch block. So now we'll go with the question number 12 now. Okay, question number 12 here. Here we're having the 56-year-old female with a known case of dextrocardia. Okay, what do you mean by dextrocardia? Dextrocardia is nothing but normally we'll be having the heart at the left side, but here there will be a right-sided heart will be there. Okay, here there will be a right side heart will be there. Okay, and that is a congenital anomaly. So in that anomaly, we can see the right-sided heart. Okay, you can see the right-sided heart. Okay, that's what we call as dextrocardia. Means situs inversus. Okay, means organ has been changed their position. We can call that one as situs, means site of the location. Okay, situs inversus. Okay, means site of the organs has been changed. Okay, which has been misplaced. Okay, situs inversus. Okay, so posted for the surgery as the cardiac fitness. Okay, surgery, cardiac fitness for the surgery. Patient has been taken for the ECG. Okay, and interpret the ECG following ECG finding. Okay. So here is the your ECG pattern. Okay, V1 lead and okay, I'm showing you the only V1 lead and VCG lead. Okay, you can see in V1 lead. Okay, you can see here. Okay, if you zoom out and see here. Okay, at that negative deflection. Okay, in V6 you can see the, sorry, in a V6 you can see there is a W wave pattern. Okay, there is a W wave pattern. Okay, in a V6 you can see the W wave pattern. Okay, you can see the W wave pattern. Okay, W wave can be seen in a V6 lead. Okay, I can see in a ECG. Okay, you can see the if the here there is a Q wave. Okay, again there is a deep. Okay, deep R wave. Again there is the upstroke of the R wave. Okay, we can say R S R. Okay, R S R. Okay, R S R nothing but a rare rabbit. Okay, rare rabbit. Okay, we can say a rare rabbit ear. Okay, rare rabbit ear like pattern. Okay, rare rabbit ear pattern can be seen in case of so it's especially in case of rheumatic heart disease, you can see the no, sorry, rare rabbit like pattern. Okay, I'm saying this one is RSR. Okay, this one is R wave, and again RS, again R wave. Okay, again there is a R wave. Again there is a tall R wave will be there. Okay, this looks like a rabbit ear. Okay, this looks like a rabbit ear. Okay, this one is if consider this one is a rabbit, so this one is a rare rabbit wave. Okay, next one can be seen in case of right bundle branch block and the rheumatic heart disease. Okay, so options are right now here. So option number A is a right left bundle branch block. Option number B is the ventricular tachycardia. Option number C is the monomorphic VT. Option number D is the right bundle branch block. Okay, I told you in a left bundle branch block only. So in a V wave, okay, you can see the RSR wave. Okay, RSR wave, and in a V6, okay, in a V6 you can see the W wave. Okay, W wave pattern can be seen. Okay, this all is a feature of a right bundle branch block. Okay, this all are the features of right bundle branch block. All of you clear regarding the left bundle branch block and the right bundle branch block. So which one is severe? Okay, which one is a severe one? So which one is severe one? Okay, we know that okay, our left heart is very important. Our left heart is very important. That's why always our priority will be saving with the left heart. That is why like LVB is very dangerous one. So that is symptomatic. You should treat the left bundle branch block. You should always treat the left bundle branch block. Okay, all of you clear? Sorry. So in a ECG, okay, so we consider the left bundle branch block is very severe one. Okay, all of you clear regarding this one. So we'll go with the 13th question. So what is the okay, 13th question, very direct question. Okay, classical ECG sign of Wolf Parkinson's White syndrome. Okay, actually this one is the Wolf Parkinson's White syndrome. Okay, we can say this one is a WPW syndrome. Okay, WPW syndrome. Okay, Wolf Parkinson's White syndrome. Okay, White syndrome. So here the examiner is asking you regarding the classical sign of the Wolf Parkinson's syndrome. Okay, here is options are right now here. Option number A is a short PR interval. Sorry, a short PR interval and a delta wave and a broader QRS complex Okay, option number B is prolonged PR interval, J wave, narrow QRS complex. Option number C is Osborn wave, epsilon wave. Option number D is prolonged QT interval and a delta wave. Okay, just try to put your answers. Okay, analyze the question. So here the examiner asking you what are the feature. Okay, cardinal sign of WPW syndrome. Okay, options are right now. Just choose a right answer. Okay, just choose a right answer in the comment box. So I'm waiting for the answer right now. So I think okay, so many people like answered. Okay, so we'll see. So WPW syndrome. Okay, normally it is a congenital syndrome. Okay, we can say it is a congenital syndrome. Okay, since birth. Okay, the syndrome will be there. Congenital syndrome. Okay, it is a congenital syndrome. WP syndrome is a congenital syndrome. Okay, where there is a abnormality with the conductive system of the heart. Okay, where there is a abnormality with the conductive system of the heart. Okay, conductive system of the heart will be there. Okay, normally, classically, you can see short PR interval, delta wave, and broader QRS is the cardinal feature. Okay, these three are the cardinal features of the your Wolff Parkinson's White syndrome. So we'll see now. Okay, what do you mean by short PR interval and delta wave and a broader QRS complex. Okay, just see. So here normal, okay, our normal PR interval will be normal PR interval. Okay, what is a normal PR interval or what is the normal duration between normal duration of PR interval right now here? So that is your 0.12 second to the 0.20 second is normal PR interval. Okay, this one is starting from the P wave QRS complex. Okay, P QRS complex QRST. So from the starting from the P wave to the PR. Okay, P. This one is R wave. Okay, starting of the R wave. Okay, this is considered to be a PR interval. Okay, PR interval. Okay, if it is more than 0.20 second. Okay, we call that one as prolonged PR interval. Okay, we call that one as prolonged PR interval. Okay, all of you clear regarding the PR interval? Then a delta wave. Okay, then a delta wave coming for the delta wave. Okay, delta wave is the slurred upstroke. Okay, slurred upstroke in the R wave. Okay, in the R wave. Okay, if there is any upstroke in the R wave. Okay, normally this one is a P wave. Q R ST, okay, will be there. Okay, that is our normal ECG. Okay, if there is any, okay, after P wave, okay, after P wave, if there is any, while going on the, you are going on the R wave, okay, if there is any slurred upstroke is there, okay, if there is any slurred upstroke is there, okay, we call that one as delta wave. Okay, this upstroke is called as a delta wave. Okay, we call this one as the delta wave. Okay, delta wave. Okay, that is your delta wave. Okay, and then to say, I told you broader QRS complex. Broader QRS complex. So if there is QRS complex duration is more than 0.10 second, we call that one as broader QRS complex. Okay, this all are the feature of Wolff-Parkinson's White syndrome. Okay, Wolff-Parkinson's White syndrome. Okay, and again there is a there are different abnormalities. Okay, Osborn wave and epsilon wave and J point. Okay, J wave. Okay, we'll see all the J wave and epsilon wave. Okay. Here you can see, okay, regarding the Osborn wave, okay, Osborn and the J wave, okay, both are same only, okay, both are same only. Your Osborn and J wave, okay, both are same, okay, J wave and Osborn wave both are same, both are okay. Your Osborn wave and the J wave both are seen in case of hypothermia. Okay, here there is a Osborn wave. I will draw the Osborn wave. Okay, P Q R S T. Okay, so there'll be a positive deflection will be there. Okay, again there will be a T wave. Okay, we call this one as the J point or a J wave, or else we can say it is a Osborn wave. Okay, it's a Osborn wave. Okay, it's a Osborn wave. Okay, that is your Osborn wave. Okay, you can see this Osborn wave in a hypothermia. Okay, in case of hypothermia, you can see a Osborn wave. Okay, Osborn wave. Okay, that is a positive deflection. We can say it is a positive deflection from the QRS complex. Okay, from the QRS complex. Okay, that's your Osborn wave or the we can say J wave. Okay, and you can see the epsilon wave. Normally, epsilon wave will also consider to be a epsilon wave. Okay, I'm draw here. Okay, epsilon wave is also seen in case of hypothermia. Okay, hypothermia. You can see the epsilon wave. Okay, you can see the epsilon wave. Okay, this one is a P wave. Then QRS complex. Okay, then QRS complex, and then again here only there will be a buried. Okay, buried epsilon wave will be there. Okay, again this one is a T wave. Okay, this one is considered to be a epsilon wave. Okay, this one is the epsilon wave. Okay, this one is considered to be a epsilon epsilon wave. Okay, see this one is also seen in case of hypothermia. You can see the epsilon wave. Okay, epsilon wave. Okay, all of you clear regarding the epsilon wave? So right answer is your so option number A is the right answer. Okay, you can see WPW syndrome in a like cardinal features are short PR interval, delta wave, and the broader QRS complex. Okay, these all are considered to be a like cardinal feature of your WPW syndrome. Okay, now we'll move towards the 14th question. Okay, 14th question. So here we are having the match the following question. Okay, here we are having the match the following question. Okay, just ignore this one. Okay, so match the following condition based on the ECG finding. Okay, we'll see the match the following. Okay, we are having the columns here right now. So column number A, conditions are there. Okay, following the here okay, right side. Okay, there is a conditions. Okay, there is a conditions. Okay, arrhythmias, and here on the left column we can have the abnormal findings. Okay, findings of the ECGs are there. Okay, so we have to see the both columns. Okay, and we have to match the both columns. Okay, we have to match the both columns. Okay, you can see the first one is Morbitz one. Option A is the absent QRS complex. Second one is first degree AV block. B is the prolonged PR interval until the draw factor occurs. Okay. Third one is the third degree AV block. C is the PR interval more than 0.20 second. So we have to match the following. Okay, match the following condition along with the ECG findings. Okay. So options are here right now. I'll read out the options. Option number A is the first one C, second one A, third one is a B. Option number B is the Option number B is first one B, second one C, third one A. Option number C is first one B, second one A, and third one C. Option number D is option number A, second is B, third is C. So options are here right now. So we'll try to try to match the all the conditions right now here. So Morbitz one. So in a second degree AV block, okay, in a second degree AV block, okay, you will get the Morbitz 1 and Morbitz 2. Okay, you will get the Morbitz 1 and Morbitz 2. Okay, in Morbitz 1, what will happen? In a Morbitz 1, what will happen? In a Morbitz 1 AV block, what will happen? There will be a prolonged PR interval. Okay, there will be a prolonged interval. There will be prolonged PR interval. Okay, I told you PR interval if there is more than, if it is more than 0.2 second, we call that one as prolonged PR interval. Okay, there will be prolonged interval until the draw factor will come. Okay, until the draw factor will come. Okay, that's what we call as prolonged PR interval. Okay, prolonged PR interval in Morbitz 1. I'll clear you. Okay, I'll clear all doubts. Okay, just see. So starting with the AV block. Okay, AV block. Okay, just talk about the AV block. Atrioventricular block, AV block. Okay, what will happen? There will be prolonged. Okay, there will be more than 0.20 second PR interval. Okay, PR interval is more. Okay, here the PR interval is prolonged. Okay, here the PR interval is prolonged. Okay, that's what we call as AV block. Okay, AV block. In a first degree AV block. Okay, in a first degree AV block. Okay, what will happen in a first degree AV block? Okay, there will be a prolonged interval. Okay, there will be a more than 20 second. Okay, there will be increased. Okay, there will be increased prolonged interval will be there. Okay, increased PR interval will be there in a first degree AV block. Okay, if we talk about the second degree AV block. Okay, if we talk about the second degree AV block, we are dividing into the Morbitz 1, Morbitz 1 and Morbitz 2. Okay, Morbitz 1 and Morbitz 2 will be there. Okay, here there will be a continuous prolonged interval will be there. Continuous prolonged interval will be there. In a Morbitz 1, okay, Morbitz 1, okay, there will be a Morbitz 1, there will be a prolonged interval will be there until, okay, prolonged PR interval until the draw factor, okay, until the draw factor will occur, okay, until the draw factor will occur, till that, okay, there will be a continuous PR interval increase will be there, okay. I'll show you the ECG, okay, along with the PR interval, okay, I'll show you the ECG. So just see, okay, if this one is your normal ECG. So if this one is your PR, okay, P QRS, okay, QRST. Again, there will be a again there is a PA, okay, again there is a okay duration of gap will be there. Again there will be a QRS complex, okay, TV will be there. Again PA, again there is a PRS duration will be more. Okay, so this is what you are like a PR interval. Okay, PR interval is variable here. Okay, PR interval is prolonging. Okay, PR interval is prolonging here. Okay, it's variable here. Okay, this one is a PR interval. Okay, normally it's going on. Okay, more than 20. Okay, more than 0.22 second, okay, more than 0.23 second, like that it's going on, okay, until the draw factor. Okay, after the draw factor will come, again there will be a normal sinus rhythm. Okay, again there is a normal sinus rhythm will be coming out. Okay, again there will be a normal sinus rhythm will be coming out. Okay, after the draw factor will come. Okay, after the draw factor will come. Okay, so that one is called, what we call as been seen in case of a Morbitz 1. Okay, this phenomenon is called as, okay, variable PR interval phenomenon is called as Wenchberg phenomena. Okay, we call this phenomena as the Wenchberg phenomena. We call this phenomena as the Wenchberg's phenomena. Okay, we call this one as Wenchberg's phenomena. Okay, Wenchberg's phenomena. Okay, what do you mean by Wenchberg phenomena? Nothing but a variable PR interval. Okay, variable PR interval phenomena is called as a Wenchberg phenomena. Okay, and if you talk about the if you talk about the second degree, sorry, Morbitz 2, in a Morbitz 2, what will happen in a Morbitz 2? So I'll draw here, okay, in a Morbitz 2, what will happen in a Morbitz 2? So there will be a continuous absent, okay, there will be a frequent absent of the, there is a frequent absent of the QRS complex will be there, okay, frequent absent of the frequent absent of the QRS wave will be there. QRS wave will be there in a morbids too. Okay, just see here, this one is a P wave. Again QRS wave. Okay, again QRS wave. Again T wave will be there. Again P wave. Again there will be, it should be a QRS complex should come, but here there is the again P wave repeating will be there. Okay. So again QRS complex, again T wave, again P wave, P wave, P wave, P wave like that. Okay, again there is a QRS complex, means there is a frequent absent of the PQRS complex will be there. So if we talk about the ratio, okay, P wave and the QRS ratio, okay, QRS ratio will be okay, 3 raised to 1, okay, 3 raised to 1 means 3 PQ will be there, and they'll be followed by only one QRS complex will be there. Okay, that's your morbids 2. Okay, morbids 2. And if you talk about the third, okay, third degree AV block, okay, third degree AV block, okay, continuous absent, okay, in the third degree AV block, okay, in the third degree AV block, there is a absent QRS complex will be there, okay, there is a absent QRS complex will be there, okay, absent QRS complex will be there, okay, here the treatment of choice will be a pacemaker, okay, pacemaker is the treatment of choice in a third degree AV block, okay, the complete absent of the QRS complex will be there. So there will be only PA, okay, only PA will be there. There is no QRS complex, okay, only PA, okay, only PA, no QRS complex in a third degree A block. We can say third degree A block as a complete hard block. It's a complete hard block only, okay. Now we'll go with the options, okay, right now here, okay, just see and we'll write down here, okay. First one, okay, morbids one, I told you, Wensberg phenomena, variable PR interval, so prolonged PR interval until the drop factor will come, okay. So first one will go with the B, okay. Then coming for the first degree AV block, okay, first degree AV block, okay, there will be a prolonged interval, okay, there will be prolonged interval more than a 0.20 seconds. So second one, okay, second one will go with the C, okay, and third degree AV block, okay, third degree AV block will go with the absent QRS complex. So A, third is the A, okay, third is the A. Just choose the right answer here, okay, 1B or 2 are here, okay, 1B and 2C and 3A, okay, so option B is the right answer, okay, option B is the right answer here right now, okay. All of you regarding the ECG, okay, this one is a part 1 video of the ECG. So in a part 2 ECG, okay, I'll be dealing with the all remaining ECGs, okay, all your ECGs in a MI and all other like your ventricular tachycardia, ventricular fibrillation, okay, all will be dealt in a part 2 ECG video, okay. Thank you for watching it. Keep on learning, keep on studying. Okay, if there is any inconvenience, okay, please apologize me. It's okay. Thank you all for watching it. Keep on learning, keep on studying. Okay.